Hi, my name is Shaina P and my topic of study is general pediatric surgery. So how many of y'all can ever imagine drowning and being underwater for 30 minutes but still living? No one? There was actually a 3-year-old girl who this happened to. It was a case study in the Annals of Thoracic Surgery, which I had read an excerpt from. There was a 3-year-old girl who had fell into an ice pond, and it was 30 minutes before her parents found her beneath the surface. By this point, her temperature was 66 degrees and she had absolutely no pulse. It took 8 minutes for the rescue team to arrive, and they did everything they could, but it was pretty evident that her brain was not working anymore. They continued CPR, but she ended up being lifeless for 1.5 hours by the time they got her to the hospital. 2 hours later, they had raised her temperature 10 degrees, and 6 hours later, it was back to normal. She was immediately rushed to the operating room upon arrival of the hospital, and she was put on an artificial lung system. The surgeons opened her chest with a powered saw and immediately put her in intensive care after the surgery with her chest still open. Within a week, her organs were returning back to normal. She was comatose for a full week, but eventually her organs started to come back to life with the help of the entire team that worked on her. Surgeons drilled holes in her skull to measure her cerebral pressure, and eventually, 2 weeks after being admitted to the hospital, she was wheeled out with only temporary paralyzed in her right leg and left arm, but after a few months of intensive therapy, she was back to normal. Winston Churchill once said, "Success is not final, failure is not fatal, it is the courage to continue that counts." And the team that operated on her clearly had the courage to continue. And this is one of the reasons why I wanted to pursue general pediatric surgery. A little bit about me. I'm 16 years old and I have a mom, dad, and older brother. I've always wanted to be a doctor ever since I was a young kid, and I just never knew what I wanted to do in medicine. I'm a part of clubs here at school. I'm in student council, and I'm the president of HOSA, which has allowed me to get more active in my society with things that I can do medical-wise, whether it's volunteering or participating in societies for cancer awareness, stuff like that. And I'm also in Health Science 2 this year, which has allowed me to get my certified nurse aide license and go do clinical rotations at different hospitals and nursing homes. A lot of people don't choose the field of surgery because it takes such a long time. It's usually at least 13 years because you have to do undergrad for 4 years, med school for 4 years, and for surgery, the residency is the longest. It can often take 5 years, followed by a fellowship of 1 or 2 years if you want to specialize. I chose ISM because I wanted to get out of my comfort zone and I wanted to pursue an internship, but I was unaware of how to do that without guidance. So this class has been great because I've been able to get out of my comfort zone and really reach out to people that I respect and get involved in the field that I want to pursue. I chose surgery because I wanted to do what the team did on this little girl that fell into the ice pond. I want to be able to save lives and make an impact in my society for the greater good. If I can one day save one life or do what this team did to this little girl, I will know that I have done something worthy. I didn't know what specialty I wanted to go farther into with surgery, so I decided to stick with general surgery, and I decided to interview around with people of different specialties. My mission statement is to broaden my knowledge in the field of general surgery. With the help of a mentor, I will design a product utilizing the information and skills I've learned while studying this career. I hope to learn different aspects of the medical world and witness surgeries to prepare myself for a future occupation in medicine, as well as better prepare myself for the rigorous road ahead, because I know that it will take a long time and it will be difficult, but it'll be worth it in the end. Everybody that I interviewed told me a general idea that were all similar, but they also all taught me different things. So something that all of them touched base on, they all talked about their path after high school, which included going to undergrad and med school, followed by residency and a fellowship. They all told me not to get discouraged and to just envision where you want to be and to keep on going no matter how hard it gets. They told me about what they do on their weekly tasks, which includes seeing patients, diagnosing them, operating on them, and following up. And through these interviews, I made new contacts because they would always give me people they thought would be good for me to talk to. So that led me to be introduced to a bunch of different people that I respect a lot. My first interview was with Dr. Jeff Angabaldo. He's a plastic surgeon from Renaissance Plastic Surgery, a private practice that he started himself. He taught me a lot about confidence. He told me that you have to be confident to be successful in this field, and that everyone starts out kind of shaky, but as you work under different surgeons and as you get more experience, you improve with practice. So he told me a lot about how, with him especially, he started out not the best, but because of all of his experience and because of his confidence, he's risen to become one of the best plastic surgeons in our area. My next interview was with Dr. Shaina P OW. She's a general surgeon at the Medical Center of Plano. She does minimally invasive and bariatric surgery and is very involved with weight loss surgery. She taught me that everything nowadays is very subspecialized where we live because Frisco is so urban. The surgeons here just seem to not only go into a certain field, but they stick to a certain type of surgery a lot of times. And she also taught me that being a woman in this field is not impossible. It does exist. Although it's a male-dominated field, there are women that are successful. My next interview was with Dr. Keith Cabaness. He's a surgical oncologist at Baylor Medical Center. He taught me about how where you live affects the kind of surgery that you do. He told me that if you live in a more urban environment, you get less variety with your surgeries because people tend to subspecialize more, just like Dr. Patel was saying. But if you live in a rural environment, you get to do a lot more variety in what you do, and you get to spend more time diagnosing patients. And this was great to hear, considering that he spent time both in a rural and urban environment. So he was speaking from experience. My next interview was with Dr. F. Alan Barber. He's an orthopedic surgeon at Plano Orthopedic Sports Medicine. He taught me about the importance of school. He told me that you have to have a balanced life and stay centered. And while you do need to have a life and be social, you need to be focused on school a lot. You need to have good grades and pass your exams because that leads to getting into med school, which leads to residency. My next interview was with Dr. Kim Rickert. She's a neurosurgeon at Parkland Hospital on UT Southwestern. She was definitely one of the most inspirational people that I talked to because she had a big impact on me. She told me her story of how she actually had a child while she was 16 years old in high school. And from there she went on to start teaching and then eventually started working in a neurology lab, which led her to go to med school and get her PhD. And by the time she was in med school, her child was already in high school. So by the time she started residency, her kid was in college and was able to take care of herself. So she taught me that with hard work, you can achieve anything because most of the time when people have children at such a young age, people don't think they'll be able to achieve much. They don't think they'll be able to go to college, but Dr. Rickert showed me that that is definitely not true. If you're determined, then you can do anything. Dr. Peter Kim is a transplant surgeon at Baylor Medical Center. I actually interviewed him over the phone because it was just too far of a drive for me to go down there, but he talked to me about taking risks in the field. He told me that although you need to remember your safety precautions and follow the right procedures and the right steps, you need to be able to take risks and you need to be able to try something new because you won't be able to get good at what you do unless you try new things. Lastly, I interviewed Dr. Minquez, who is a pediatric surgeon at Children's Medical Center. He taught me a lot about how with pediatric surgery, it's a lot different than surgery in adults because the field is a lot more broad. As in, with all the subspecialization that Dr. Patel was telling me about, it's a little bit opposite for pediatric surgery because it's its own specialization. So Dr. Minquez is able to not only operate on children with ruptured organs, but also children with cancer. He gets to diagnose patients in a clinic and talk to patients every day. So out of everyone that I interviewed, he definitely had the most variety in his field. And he also told me about how great it is to work with children every day because ultimately the children are the future of our society, and if they're not okay, then the people that are old now will not be okay in their future. And I was actually talking to a technician in the ER at Plano Medical Center when I was on one of my clinical shifts, and he was telling me that when it comes to old people coming into the ER versus babies, when it's an older patient, people don't tend to rush as much because they think that they've lived their life out. So, I mean, they do everything that they can to save them, but if that patient just so happens to pass away, he said at least they've been able to live a full life and do what they've always wanted to do. Whereas if a baby comes in, they have a massive team trying to fix them because children have their entire lives ahead of them. So it's definitely one of the most important fields of our society because without them, our children would not be able to advance and follow their dreams. My initial research was kind of scattered because I didn't know where to start. I started with common surgical procedures, which just consisted of me researching basic procedures and surgeries that every surgeon should know how to do, from diagnosing a patient to simply doing a biopsy. It was just kind of common knowledge that most surgeons have done but in their life or know how to do. My second research assessment was over gastrointestinal tumors, and while it taught me about gastrointestinal tumors, it also taught me a lot about case studies. A lot of doctors are active in case studies and research, but it does take a lot of time. It taught me that you have to be dedicated for oftentimes several months or a year, and you have to have a great big team to help you accomplish these things. My next assessment was over robotic-assisted surgery. A lot of people that I talked to in my interviews did laparoscopic surgery, and this is kind of a different take on it. With robotic-assisted surgery, it's basically minimally invasive, just like laparoscopic, only the machines have greater flexibility. So Dr. Patel was telling me about it. She said, with laparoscopic, you should consider yourself using chopsticks, like as if you're going in and making small cuts with those. But with robotic-assisted surgeries, it's as if these chopsticks have wrists and arms, and they're more mobile and able to complete the job with ease. My next research assessment was over the UNT visit that we took for ISM. The first class that I attended was a play therapy class. They were talking about how helping children with certain objects and stuff like that can be beneficial, but they also talked about how kids should learn to be independent also, because you shouldn't be helping them with something that they can do themselves, and it also kind of piqued my interest in going farther into pediatric. The second class that I attended was a biochemistry class. That specific day they were talking about this thing on the screen, which I'm sure nobody knows what it is because it looks extremely weird. This is called a lectin. It's a protein that binds carbs together inside your body, and this class taught me a lot about not only the micro anatomy in your body, but also that I'm going to have to learn it all. And everyone in there was so determined in that class and focused. It taught me that I'm going to have to take all these classes that are extremely specialized in the human body and stuff like that, and you can't just skip out on that because you do need to know it later in your life to go into this field. My mentor is Dr. Robert Minkus. He's the pediatric surgeon that I was talking about earlier at Children's. He attended the University of Miami for his undergrad, then went to Tulane University for his medical school and PhD, followed by Washington University for his residency, and did his fellowship at St. Louis Children's Hospital. I chose him because not only did he show the most variety in his field, but I could immediately tell that I would learn a lot from him. He's very open and kind and very willing to learn. I've learned so much in the time that I've spent with him already, and he gave me a great idea for a final product as well, and you could just tell that he was one of those people that wants to pass on their knowledge, which I really respected. The first thing that he had me look at was articles about a checklist. So, who's ever used a basic checklist in their life to do anything? And did it help? So this is kind of what it was talking about. As simple and stupid as it may sound, checklists in medicine have actually prevented a lot of surgical errors. On average, there are about 80 surgical errors made every week in the U.S. by various surgeons. And basically the focus that Dr. Minkus wanted me to start looking at was how to reduce these surgical errors, because they do cost up to $1.3 billion in reparations and also have an irreversible toll on the patients that they're done on. He wanted me to focus on patient safety, so I read up on this, and it was actually implemented by Dr. Peter Pronovost in Johns Hopkins Hospital. He implemented it in his ICU with catheter infections and saw that after using the checklists, they saw a great decline in the amount of infections that they had and the amount of patients that were being rushed into surgery and dying. So the checklist has definitely served to help medicine and reduce surgical errors and errors in general in hospitals. So this led me to my original work. The most important thing going into surgery is hand hygiene, so I was kind of staying on the side of patient surgery. So what I started with was listing out all the surgical attire that is required by surgeons to be worn in the operating room, or really anyone that's working in there. This includes a head cover, a mask, a gown, gloves, scrubs, shoes, everything you could possibly think of that's sterile to cover their entire body. Then I researched hand hygiene, which included scrubbing, which takes about 5 minutes just going into surgery and then 5 minutes coming out, because you have to make sure that everything is absolutely sterile before going in and operating on someone. Then I also researched gowning and gloving, so there is a specific technique that you have to use when putting it on, because you cannot touch anything with your hands because that would make it unsterile. So this definitely showed me the side of medicine where it showed me that you have to be extremely precise and careful with everything that you do, because if you don't do these simple things, everything could go wrong because it could easily spread infection and cause deaths. So it definitely taught me a lot about patient safety and how to reduce surgical errors by staying basically clean. And then also I did a research introduction to kind of introduce my topic and my final product. So what this was about was basically how I can get involved with patients. Being that I am so young, there's not much I can do in the field of surgery, but I wanted to find a way that I could really connect with them and give them a way to feel better. So Dr. Minka suggested making an informational app. So basically what I plan to do with this is get about 20 to 30 procedures that I see and make checklists of everything that's going to be done to the patient before the procedure, during, and after the procedure. This way patients, if they're old enough, and parents can download it before the surgery and see everything that their child is going to go through, because if you've ever had a surgery and you remember it, I'm sure your parents were very worried, because parents do tend to be overprotective. Basically, my part in this is I'm going to be producing all the content for this project, and I will do this with research, and I will obviously tweak it after seeing procedures and have it checked by Dr. Minquez. And to make the app happen, I have a programming team of students at the Kate Center, and I will be giving them the content so they can eventually produce it and put it into an app that people can actually use. I plan for this to teach me a lot about not only the procedures that I plan to do later in my life, but also about everything that a child has to go through when they are in surgery. So this will definitely teach me a lot, and I'm really excited to start researching. Recently I've been able to observe some of my first surgeries, and I've gotten to see implementation of the checklist itself, because before operating they do have to go through a list of steps and ask certain questions. Everyone has to introduce themselves and see what sites are marked and a whole bunch of different things. And I got to see in person how it actually affects the surgery overall, and it did make it a lot smoother. So by observing this in person, I learned a lot more than I could ever learn just from reading a book. So this is how I plan to implement my time observing with my final product, by observing and seeing how it really affects patients and what the procedures are really about. So I'm looking forward to my time with Dr. Minkus this year, because he is definitely very open to teaching and letting me learn, because when he operates, he has definitely pointed out different things that I didn't know before and told me what he was doing along the way and giving me articles so I can know what I'm actually seeing. He's been very helpful in the process, and he is definitely an educator in many ways, so I am so excited to continue my year with him. And I hope to learn so much more so that one day I can do what the team did for that 3-year-old that was stuck under the ice pond. And that's all. Thank you for listening.
Look at the time real quick before you shut it off.